Presented to you this evening by the Baton Rouge Sigma Alumni Chapter of Delta Sigma Theta Sorority Incorporated Physical and Mental Health Committee. And I would like to welcome you. My name is Michelle Dennis. I serve as the chair. I serve as the chair of the Physical and Mental Health Committee for the Baton Rouge Sigma Alumni Chapter. Before we get started with our presentation this evening, we would like to begin with our DREF presentation from our area and regional coordinator, Sora Kiana Cropper-Patan, and she will begin first, and then we will start our program afterwards. Thank you. Sora Patan.
Good afternoon, Soras, and to all our guests tonight. Thank you so much. Can I have sharing privileges?
You should have it now.
Perfect. Okay, perfect. Again, thank you all so much. Again, my name is Kiana Cropper-Patan, and I am the Baton Rouge Citywide Coordinator for Delta Research and Educational Foundation All of Us Research Program. I bring you greetings from Delta Research Educational Foundation Executive Board. I just want a brief moment of your time to talk about why DREF research matters for all of us is so important. Of course, our goal is to create awareness, encourage health and wellness, and educate the African American community on the importance of research. Why is research important for us? Research is important to improve healthcare outcomes and to decrease health disparities in our communities. It is the catalyst that fuels this approach to individualized prevention and treatment called precision medicine. Precision medicine was established during President Obama's term, where basically it says that medication and treatment for disease is specific for us. So in order for us to make that specific for us, we have to participate in the research so that we can have the correct treatment for us to improve our outcomes. Again, the mission and objectives are to accelerate, nurture relationships, catalyze a robust ecosystem, and deliver the largest, richest biomedical resource ever. Our core values are to be open, to always be diverse, have partners involved, be transparent, access, and security and privacy. Only thing that's asked of our participants is that they answer surveys, sometimes provide biosamples, physical measurements like Fitbits, etc. We promise to fight disease for our participants, allow them to learn more about their health, and to assess their own data. To learn more information, you can visit researchallofus.org, or I'll put the link in the chat, or you can scan this QR code to find out more information and complete the survey. As we close out on our 5th year of All of Us with DREF, we are really focusing on trying to get as many people signed up as possible. Please click the link, or you can send me a message in the chat for more information. Thank you all so very much for allowing me to have a brief commercial tonight, and I look forward to hearing our important information on maternal health in the African American community. Thank you so much, Sora Dennis.
Thank you, Sora Cropper-Patan, for your presentation, and thank you for joining us this evening. We appreciate it. So this evening, we want to present to you on the crisis of the maternal healthcare for women of color. As we all know, that Black and brown women, especially Black women, we suffer a higher rate of mortality during delivery than any other race. And it's really been brought to the forefront. It's been a problem consistently, but it's been brought to the forefront even more so in the past couple of years. So we really want to make sure that we touch on that subject, as we all know, or unfortunately may have lost someone during childbirth. So we really want to touch on that. And this will be an interactive session at the end of the presentation. So if you have questions as you go along, we will be monitoring the chat. for your questions, and we'll try to provide as much feedback as we can during the session. So tonight's speaker here with us is, she's a nurse practitioner, and her name is Shanika Velour-LaDuff. But before we get into our speaker, we want to show a short video first. And some of you may have seen it. The video that we're going to present is Kiara's story.
There should be a button on, I'm sorry, hi everyone, this is Shanika. There should be a button on the presenter menu that says share sound that will allow us to hear the sound in the video.
I know in this situation an apology is not enough. But from the heart of this hospital, I'm here to offer one. Your wife suffered what we refer to as a never event. Something that should never happen.
I got an email out of the blue from an executive of the resident. And then she goes on to tell me, we'd like to do an episode of the show inspired by Kira's story and then dedicate the episode to Kira. And I was like, what? Kira went in for what was expected to be a routine scheduled C-section at Cedars-Sinai Hospital on April 12th of 2016. And we expected it to be the happiest day of our lives.
I'm scared. You're gonna be okay. Everything is gonna be okay. All right, I'll take it from here.
The doctor tells me she'll be back in 15 minutes. 15 minutes. And that was the last time I saw my wife alive.
This happens far too often to women of every color.
But it's 4 times more likely to happen to Black women. That's a fact.
The way that she touches people's lives and the way that her story resonates with people never ceases to amaze me. And I'm so honored to see these talented, gifted actors pouring their hearts into these roles. What we've accomplished together here with the residents, just couldn't have a better time for us to rally and come together and raise awareness about this issue.
The United States is the most dangerous country in the developed world to give birth in. There's no excuse for that.
Women all over this country deserve better. There's no statistic that can quantify what it's like to tell an 18-month-old that his mother's never coming home.
There's nothing I can do to bring Kira back, but the highest honor that I can pay Kira is to make sure I do everything I can to send other mothers home with their precious babies.
Tonight's speaker for our Wellness Wednesday moment is Shanika Velour-LaDuff. She's a family nurse practitioner who focuses on women's primary care and maternal child health. She's worked in women and children's health for over 15 years, with over a decade of experience in OB services. Shanika founded Labor and Love after experiencing her own hardships during pregnancy, birth, and the postpartum period. Through this organization, families receive support during the prenatal period, through infancy, including childbirth education, doula services, postpartum support, and mother-baby health services. Shanika is passionate about the health, wellness, and well-being of all mothers, children, and families. She puts a lot of labor and love into all of her work. The mission of Labor and Love is to educate, advocate, and empower women using their motherhood journeys as a source of empowerment. Shanika strives to provide the highest quality of care to all of her patients and clients, as well as equipping them to be active healthcare participants. She believes by strengthening the health and wellness of the woman, the entire family, and the health and wellness of the community can be positively impacted. Her life's work focuses on educating and empowering patients while being a strong health advocate for them. We welcome you, Shanika, and thank you for joining us this evening.
Good evening, ladies. I think I turned my camera on, but I don't see myself. I don't know if you guys can see me. I have no idea what's going on with the camera. Thank you for having me. That video gave me goosebumps. I am very familiar with Kiara's story, but I've never seen that episode of The Resident. I don't even know if I can handle seeing it, but I know that her story is something that resonates with all of us, whether or not we've known someone personally who's died in or as a result of childbirth or the aftermath of childbirth. Every time we see a Black woman lose her life and a Black child without their mother, I think that touches us all. And that's just something that that nobody with a heart should be able to sit through, right, without feeling something. I'm really happy to be with you all tonight to talk about the disparities that plague Black women in the United States, but I believe we're all in Louisiana. Those statistics are so much worse in our state, and it's unacceptable. I have been working for a long time to try to fight these disparities and to try to equip women with the support, the education, and the advocacy that they need to make their motherhood journey empowering, to take away that fear. I started doing this work some time ago. I first started working in OB back in 2011. And when I first started doing this work, it was rosy butterflies, all about like the baby in this beautiful moment. And it seems like as time has progressed, it's become more serious work and more heavy work, in the sense of, instead of my clients telling me about how excited they are to decorate the nursery and ask about what sort of things they need for breastfeeding and bottles, the conversations turned into, please don't let me die. I'm scared that I'm not going to live through childbirth. I'm scared that my husband's going to have to choose between me and my baby, and what are we supposed to do? And I feel like Black women go into what's supposed to be the most beautiful time of their lives with this fear. And going into it with this fear instead of the beauty and excitement takes away from the experience from the back. And so what do we do to make sure this experience that's beautiful for everybody else most of the time is as beautiful or even more beautiful for us? And so the work that we do at Labor and Love includes education. So we prepare women and their families to know, first of all, what's normal, what's expected, and also, more importantly, to know that you have the right to call the shots. Most women don't know that they are really in charge of their healthcare, they're in charge of their birth plan, and they are really the boss when it comes to their experience in the hospital. So we equip our clients to ask questions. If you don't understand, ask more questions. Have your partners, your family, and everyone involved, because you know yourself and they know you better than the nurses and the doctors who are taking care of you. So if something is off or something's not right with you personally, we want them to be able to speak up and not stop speaking until they get the help and the resolve that they deserve. In teaching community classes, I've come across women who are having like their third baby, and they ask, oh, when did that start? When were women allowed? When did it start that we're allowed to have a say in what happens? And that has always been the case. It's just that most of us don't know that we have that right to speak up. And so we are all about educating women and their families and equipping them to be those advocates, and also being there with them. So if they don't have an advocate with them, we are that advocate for them to make sure they go into this experience with minimal fear, because 9 times out of 10, we've already addressed those fears before we even get to the hospital or to the labor room, but also making sure that they come out of this feeling strong, happy, and in love with the experience they had. I did have some statistics and things on a slideshow. I don't know if I have the capability to share, or if there's any other things.
Yes, you do. You have shared capabilities.
Okay, let me see if I can pull that up. Let me just put this in presenting mode. I think, oh wait, I'm all out of order with the slideshow, guys. Give me just a second. So nationally, Black women are 3 to 4 times more likely to die a childbirth-related death than our counterparts of other races, or basically than white women. These are the disparities in Louisiana. Louisiana has consistently, for the past few years, received a grade of an F when it comes to Black maternal and infant mortality rates. We are leading in failure when it comes to birth outcomes, when it comes to preterm labor, and also when it comes to Black babies living to see their first birthday. We're also failing in breastfeeding rates, which is something that we work really hard to improve in our communities. Contributing factors to these deaths can include adherence or not adherence with medical regimens, but we already know that lots of times, especially as a healthcare provider, the patients I come across, when they see me, I really try hard to incorporate a personal experience, first of all, someone they feel comfortable with meeting with about their health, but I also always try to incorporate education. I've had patients my mother's age or older tell me I'm the first healthcare provider to explain to them healthy living, to explain to them what the medication is for and really how to take it. Now, how many of you guys know people in your family, your mom, your auntie, if someone just tells them, hey, you have to take this pill, and they don't really understand why, how, or what the pill is going to do, how likely are they to really take that pill?
Not likely.
Not likely. So most times we have Black people in general, but Black women get this diagnosis in their medical record, non-compliant. Patient is non-compliant, and it's actually become a legit diagnosis, a medical diagnosis, when how can you be expected to be compliant when you don't even really know what's going on and you don't have an understanding for yourself? So healthcare workers tend to treat Black people as numbers, and to think they can dictate to us what we do with our lives, with our health and our well-being. And honestly, the opposite is true. We all know the saying, when you know better, you do better. And so when we equip our community with the education of what's really going on with them, whether it's a chronic health condition or something related to pregnancy, they are more likely to be compliant and have better outcomes, or even play an active role with deciding what sort of treatment they're more likely to follow through with. So it's all about really meeting people where they are. It's all about meeting people where they are and seeing how we can best help them. I don't know what I'm still trying to figure out the camera. Continuity of care is another big component. So we want to make sure our community, women in our community, know you have the right to select your healthcare provider. Sometimes we are in community health situations, which I love community health. I work in community health, but sometimes community health situations mean you're not always seeing the same provider for every visit. And it's really difficult for those providers to form a relationship with you where you feel comfortable asking questions or even continuing the conversation that you had with the provider at the previous visit so that you can follow up on the care and the outcomes of what's going on. So all of these are factors that people in the community, women in the community need to know it's their right. Even a pregnant woman, if a pregnant woman comes to you or any one of your family, friends, or women in your community say, hey, I'm about to have my baby, I'm 32 weeks pregnant, but I really don't have a connection to my healthcare provider. I don't feel like I'm listened to. They can always switch and get another healthcare provider. When you are in the most intimate type of healthcare you're going to receive as giving childbirth, you should feel really comfortable, safe, listened to, and have a good relationship with that provider. And I come across a lot of women who don't know that they can switch, or they think, oh, I'm past 20 weeks, it's too late for me to switch to someone else, when you can actually switch whenever you like, because you never want to be with a healthcare provider you don't feel comfortable with. I think my slides are messed up again. I don't know what's going on with my slideshow. Wait a second. There we go. All right, maternal mortality rates. So here are the rates from 2018 to 2021. So these are the statistics we had available, but the grades just came out rating 2022, and we're still at an F in Louisiana, unfortunately. And like I mentioned, those rates, the disparities that we're looking at include preterm labor. So the preterm labor rate in general is about 8 or 9%. Among Black women in Louisiana, it's 16.9, which is terrible. Low birth weight is also a huge component to whether or not the babies have a healthy start and make it to see their first birthday. So we're failing in that aspect as well. Nationally, the breastfeeding rate is about an 84, and in the state of Louisiana, it's below 70. So all these things are statistics that fight against women in the community, and we know that the communities that do worse in these numbers are the Black communities. So we really need to be in the communities doing advocacy work, educating and preparing women for this journey. Let's see if I get the right slide this time. Nope, I don't know why it's doing that. All right. So what are we doing about this? I already mentioned to you the work that we're doing, but we're really striving to eliminate the healthcare disparities and decrease the maternal and infant mortality rates, particularly in Black and Brown communities and those that are severely underserved. We want to provide improve overall health and well-being in the communities, and improve maternal child health outcomes. The way we do this is by giving high quality services. So all of our services are high quality. All of our team members are experts, and the services we give in low income communities are exactly the same as the services that will be given in affluent communities. So there's no such thing as low cost or free services means cutting down on the quality. We don't believe in that. We want to prepare moms and families to be advocates, but we also want to help prepare healthcare, birth, and community workers to deliver high quality services. Some things we do doula support. So that this is full spectrum doula support. So before, during, and after pregnancy. Lactation support services. We do health education courses related to childbirth, but then also related to other health conditions. Home health visits for high-risk moms and infants. We do healthcare worker and birth worker mentorships and trainings. We do distribute health and hygiene products for moms and babies. And we do a lot of community and advocacy work. And I already know what the PowerPoint's going to do. Oh, it worked. Do you all have any questions or comments for me?
So I think I'll start with a few questions about your practice and departments within your practice. So what's your caseload at this point? How many women are we talking about that you're touching the lives of?
Oh my goodness, the caseload is tremendously growing over the past few years. I can't even give you a number. I know that we have have a team right now of 7, and we are looking like we need a bigger team because We're having babies left and right. We have moms who need this support all over. And the good thing is more people are starting to know that this is a thing, and more people are starting to seek that support. And that's really what we want. We want women to know that this is something that's available to you, regardless of the type of birth or pregnancy you're having. And we want to be there for you to give you that support and prepare you for it.
Kiana, you have your hand raised.
How do we send referrals to you?
Oh, I love that question. We actually have a referral email, which is referrals@laborandlove.org. So referrals with an S at laborandlove.org.
Thank you.
Thank
you. Do you partner with the local WIC programs?
We do. So we partner with local WIC programs. We partner with Healthy Start programs. And then we have a few other community partners that we work with to make sure their moms are served.
Do you find yourself competing with mama and grandmama? So, pregnant woman wants to come in and she is really into the recommendations you make as far as your choice and, how to nourish the baby and the newborn. But there's still that voice at home. What's your experience with that?
So the way that usually goes is, mamas and grandmamas have the wisdom, right? And they want to impart that wisdom on their daughters and their grandbabies. But so typically we'll have a mom who says, well, this is what my mom is telling me. My mom didn't breastfeed and she's telling me I don't need to breastfeed. They're saying this and that. And instead of conflicting with grandma or whomever once we get there, we do a whole education session. And once mama, grandma sees the way things have changed and the trends and the benefits of the things that we're doing nowadays, they usually do support. It all falls in line with that. When you know better, you do better. And, not saying, and we always try to come from a standpoint of not saying that what you're saying is wrong or what you did was bad. But studies have shown that now this way would be more beneficial, if possible. We do actually teach a grandparents class. And I always tell the grandparents, you know way more than me because you've been there, done that. So please teach me something because I know that you have a lot of wisdom to give me. But I'm here to go over different safety precautions with you and to teach you about how you can best support your daughters or your sons when they are becoming parents. Different things have changed as far as feeding, as far as sleeping, car seats, all these things. So it's lots of different guidelines. We just try to let them know why it is the way it is now and why the recommendations are.
Do you see a lot of moms coming in with significant others, partners, husbands?
Yes, actually, yes. A few years ago, it wasn't as much, but now we are getting partners who are very involved. They know what's going on in the world today and they want to be educated. They're also really excited about their fatherhood journeys. We do have a fatherhood class that's really fun that allows the men to kind of ask their questions and give their perspective. So we're seeing a lot more partner involvement, which is amazing.
Anisha, you have any questions in the chat?
Let's see, it looks like we do.
Yeah. How much does implicit bias go into the treatment or mistreatment of women of color when it comes down to labor and delivery?
So I feel like in 2020, everybody had to do implicit bias training, right? Every hospital, I was working in a hospital at that time, and we had to do the implicit bias trainings. Implicit bias, I think, is a huge component in the treatment of Black women. I've met a few professionals, and when we talk about the disparities among Black women, they ask, well, you think it's something genetic? Is it something I've literally had people ask me, is it something genetic in Black women that make them die more during childbirth? And realistically, something that we see is Black women really aren't listened to or taken as seriously as other races when it comes to complaints. I don't know if implicitly people feel like we're more dramatic, but it kind of comes down to the point where we have to equip Black women with buzzwords so that they know, okay, if I go into this and I use this certain terminology, they're going to listen to me, which is really sad. My husband actually helped me realize this when I was dealing with the client this past year. She kept getting dismissed by provider after provider, and she really had some serious things going on. So I was on the phone with her as she's in the hospital, giving her the words to use, the certain buzzwords. And I was so frustrated, so upset about it. And my husband told me, you have to prepare Black women to go into hospitals the way Black families have to prepare their sons to be pulled over by the police.
Wow.
And y'all, every time I think about him telling me that, it gives me goosebumps because it's really so serious. Like, we have to prepare Black women to know this is what you say to get them to listen to you and to make sure you make it home safe. And it shouldn't be that way.
I recall, of course, this was 31 years ago, but I recall the questions they asked me. Of course, my daughter came in at 10 pounds, 1 ounce. And each shift of nurses kept asking me, is this your first pregnancy? Yes, I was 29. Yes, it was my first pregnancy. And then the last shift nurse asked me, are you sure?
Huh?
Yeah. And this was at a well-known hospital.
Wow.
Who shall remain nameless.
Okay. Yeah. See that sort of treatment.
Mm-hmm.
Yeah, I with my first baby, and you know, it's a health record. So when you come in, they read your record, and there was a bunch of Caucasian nurses, and they had no problem coming in. Oh, so you work at Earl K. Long? You're a registered dietitian, right? That had absolutely nothing to do with the birth of my child. Mm-hmm. And I honestly believe, had I been someone with a different demographic, mm-hmm. they would have acted accordingly.
Oh, yeah. And it's really sad because people shouldn't have to know who you are mm-hmm. to treat you well.
No.
Being a human should just be enough to be treated with the utmost respect. And yeah, that's really sad that so many of us have that story. I had the benefit of delivering my daughter at the hospital I worked at, and I had it was like delivering at home because I had worked there for so long. And of course, my birth experience was not the best. It ended up being an emergency type of situation that scared the heck out of all of my family. And I do feel like I was cared for extremely well because everybody knew me and everybody who was there loved me, whether they were on my care team or not. And I do feel like if I didn't work there and I wasn't considered a family member there, I often wonder, would I just have been another patient named Shanika who didn't make it or who had such an adverse effect because, I wasn't who I was. And that's sad to think that way.
Are there any other questions out there? Feel free to unmute yourself or a story.
So should expectant mothers go with someone to all of her appointments and like carry a notepad and, make it known that we taking notes?
A notepad is always a good thing. A notepad is a good thing. Being prepared and knowing which questions you want to ask, because a lot of times we're at home and we're thinking, okay, I want to know about this. I want to be sure I tell my provider this. I want to ask about this. But when we get there, things go so quickly, or they're giving us so much information that what we really came in on our minds is forgotten. So yeah, taking notes is always a good thing. Letting them know, hey, I'm going to ask questions and I'm going to keep asking them until I understand. And you also want to make sure, even when you're selecting a provider early on in pregnancy or even before pregnancy, does this person have the same values I want whenever my labor experience is going to be? Because if not, that's not the right provider for you. And I always tell people, everybody is not for everybody, and that's okay. It's all about finding that person who's going to work well with you and for you. Hire a doula. I see Jasmine's in the chat. Jasmine is a doula. She's saying hire a doula. We love the birthing team. Jasmine is one of our team members who is absolutely amazing.
Yeah,
And Jasmine just had a
and
baby.
I
She's a new
totally
mom.
agree with the doula. But of course, I mean, everybody has not heard of a doula.
Yes.
And we need to share that information a whole lot more broadly than we actually do. I have a few friends who are doulas here in Baton Rouge, and it's a wonderful thing. And they get, I mean, they just have to stop, accepting new clients or whatever. But yeah, the doula is a really good advocate and supporting the process.
A huge advocate. I think some years ago, people who, if you didn't know about a doula, you knew about a doula from someone who probably had a home birth experience or someone who was all natural, planning to not have any medications. And so that was the notion. Doulas are only for those sorts of moms, when actually you can have a doula no matter what type of birth you have, whether it's in the hospital or at home. Even moms who have cesarean or C-section deliveries can have a doula. A doula is all about supporting mom and the entire family through it all. So helping you prepare for your experience, being there physically with you to give physical support, emotional support, and also that information.
So what is the state of Louisiana doing to improve their grade?
The state of Louisiana is encouraging and working with lots of initiatives. So in the past few years, we've been awarded some HRSA funding to allow Healthy Start, National Healthy Start, to focus on Louisiana, giving moms doula support, giving moms home health visits, making sure they have access to all the resources, including WIC, breastfeeding resources. And so there are things available, but it's slowly getting to where we need to be. I think it's going to take a lot more boots on the ground and a lot more time to get everybody up to par. But they are making initiatives and working to improve the grades.
That's been an uphill battle. I worked with the nutrition portion of that with the WIC program for 13 years. We made some traction, created some partnerships, referrals, had breastfeeding peer counselors in the hospitals across the state. And it's a funny thing that we also had some studies done. North Louisiana does not statistically, and what the data showed is that women in North Louisiana don't really appreciate the benefits of breastfeeding because it is perceived a status symbol to be able to afford formula for your baby. Those in the more southern regions of the state are more inclined to breastfeed, especially if their mothers and grandmothers breastfed. So it was just, and that was the data of that time. I don't know how much that has changed or if anybody has even measured that since we did. But what's your experience with breastfeeding and the success of it and the reception of breastfeeding in your practice?
Yes. So when was the numbers you just gave or the information you just gave from Northern Louisiana? When's that from?
It had to have been around 2016.
Okay. Because that is something we see historically. I know personally, I was not a breastfed baby. It was just seen as, hey, I can get formula, however we're getting it. And breastfeeding generations ago was seen as something for poor people who couldn't afford to get formula. So you had to use what the Lord gave you to feed your babies. And now we know that there's nothing that compares to breast milk. And if moms do have the ability to breastfeed, we want to encourage them and support them to do that as much as we can. So what we typically see is, like we mentioned a few minutes ago, grandparents or grandmothers who are not familiar with breastfeeding, so they don't know how to support. So we educate everyone. I know I told you guys that nationally there's the breastfeeding rate nationally is 84. In the state of Louisiana, it is below 70. Last year for our labor and love moms, meaning the moms who receive free services from us in underserved communities, our breastfeeding rate was 80%. And these were moms who lots of times were not first-time moms, but it may have been their first time breastfeeding. And we find that when we prepare them before The hospital, educate them, educate their families, and let them know what to expect. It's not going to feel good for those first couple weeks, but it's something that with the right support, we can get through those first hurdles and help that journey become easier. We also like to encourage families or educate families to know that the components in mom's breast milk change to be exactly what the baby needs. So especially during times of COVID, everyone was concerned about, hey, what if my baby gets sick? Your breast milk changes if you're sick or if your baby's sick, because your body picks up on those signals to increase antibodies to help baby's immune system fight off whatever they're exposed to. Yes, and Jasmine's putting in the chat, the formula shortage has definitely impacted the rates as well, because a lot of people are afraid to use formula. So people are now turning more to, hey, can we talk about breastfeeding? And so I do feel like it's been gradually increasing over time. Jasmine, you can feel free to unmute.
Yeah. And it's regarding the less glamorous part of maternal child health, which is, demise.
Yes.
So, how is that, like cause of death? Has any data been collected with more preeclampsia, cardiac arrest? What are we seeing as, those cause of deaths in our women, African American women, most especially?
It varies. Sometimes it can be related to preeclampsia. We had a mom, I think it was in March, who went home. She had her baby, and she was just educated on what was normal and when to call somebody. And she kept having these really bad headaches, spots in her vision, and she called a team member, and she was like, I don't feel right. And I think she wasn't even a week out of delivery, and she was really, really swollen. We sent her to the emergency room. She had preeclampsia, and it saved her life. The fact that she had someone she felt comfortable enough to call to say, hey, I don't feel right. Something's going on. I had another mom that I will never, ever forget this lady. She didn't have any support. I went to do a high-risk home visit on her. Her blood pressures were extremely high, and we had to start on medication and everything right away. She was a typical patient that had I feel like this, had I not knocked on her door to do an assessment and a health visit with her, she would have been a mom who could have died and nobody would ever know, because it was just her and her newborn baby with nobody else coming to check on her. She didn't have family, she didn't have support. And so many women go into childbirth and the postpartum period not really knowing the warning signs, or thinking, oh, this is normal, or I just went through childbirth, so I'm supposed to have pain. Some women think, oh, I'm supposed to have a bad smell after delivery, when that's actually not the case. And so when we have these concerns, it's important to know, hey, I'm going to go get checked out. We should all be equipping women with a list of what's not expected. And if you have this going on, let's go back to the hospital and get checked out.
And I'm not going to let you slip by this, in passing home visit thing, because that is just awesome.
Oh, thank you.
I don't know if that's, a routine business model or what, but a home visit for someone who does not have transportation, or is, like you said, high risk, that's a game changer.
It is. A lot of times, and that goes into that non-compliance. A lot of times patients are labeled with that non-compliant diagnosis, and we don't know the reason she's not compliant. We don't know what her transportation situation is. We don't know the sort of childcare she has, what sort of issues she has. We actually had a mom recently who couldn't leave her job. Her job wouldn't let her leave. She was a pregnant woman.
Mm-hmm.
And she sent me a text and she said, hey, this is what I'm feeling. And it was something that I was concerned about. So I said, you need to go to the hospital right now. She said, oh, my job won't let me leave. Excuse me?
Mm-hmm. Mm-hmm.
So we don't know what sorts of social determinants these women are facing to give them a label of non-compliance. And so the home visits is not routine. It is something that we actually do through Healthy Start, something that the Healthy Start initiative has allowed us to implement. But it is basically to bridge those gaps, because everyone is not able to make it to every prenatal appointment. they can't make it to all the postpartum appointments. Some women just simply don't have a postpartum appointment because they don't have the time or the means to get there. And so just trying to reach those women who are at high risk and who have those social determinants of health, fighting against them.
So what does outreach look like to reach moms, particularly young moms,
I'm
like
sorry,
18?
It's going in and out. I'm so sorry. It was kind of breaking up.
I was asking what
I still can't hear.
Particularly for your really young moms.
Yeah, you're breaking up quite a bit. I think she was asking, what does outreach look like for the young moms? What are you using to attract them?
Oh, that's an awesome question, because this is something that we've recently been presented with. So we had a few high schools reach out to us, and Jasmine has been working really closely with teen moms. So first of all, we're going into high schools to try to reach the young girls before they even get to that point, before they get to the point of motherhood, so that we can equip them with body autonomy and self-love, self-respect, and how to take care of yourself when you're entering young womanhood. But for the moms who are teen moms, what we've seen historically is people see it as a punishment, right? Even in the hospitals, we see, oh, she's things like, and this is hypothetical. I'm doing my quotes, even though y'all can't see me because I don't know why my camera's not working. But we get those hypothetical situations where, oh, we're gonna let her wait on that epidural so she can learn from this. When that's the exact opposite of what needs to happen. Not only is this a mother, this is a young girl who needs to know that she's cared for, loved, and supported. So we are there for young moms to teach them and meet them wherever they are, to support them and give them a loving situation the same way we want a loving situation or a loving experience when we go in. So we have been working with a few local high schools, and we are actually, Jasmine and I just talked, we had a meeting this past week about expanding our programs, going into even more schools around the city and hopefully around the state pretty soon to impart these values on women. Yes, Jasmine's putting community baby showers are a big hit.
Mm-hmm. Dr. Dennis, any comments from you?
I have one last question. Are you all going to try to connect the churches?
Yes, that would be amazing to connect with churches. We have not so far done anything with the church besides I have a connection who recently asked if we could do a talk about breast cancer at her church in October for Breast Cancer Awareness Month, but that'll be our first experience. But yeah, anywhere we can reach people in the community, especially those communities that are near and dear to our hearts that we really want to be in teaching and reaching women, that's where we want to be.
That's good.
All right. I just want to put an additional resource as we're talking about women and pregnancy and young women in pregnancy. In our community, there is a diamond that a lot of individuals do not know about. If you are aware of a young lady or a female that is pregnant, I would definitely want to encourage each of you to tap into our YWCA. We all know about YMCA, but some of us are not familiar with our YWCA. And within our YWCA organization in the Baton Rouge area, we have what's called an early Head Start program. But within that early Head Start program, there's also what we call a pregnant mom's opportunity to be into that particular organization. And with the pregnant moms organization, what happens is if you are a female that's pregnant, generally your first time pregnancy, you have an opportunity to come into the organization get some of the classes like we're interacting with this evening, as well as have a nurse assigned to you to monitor you along your pregnancy, not interfering with your assigned doctor, OB/GYN that you already have in place, but just additional support to help with health and wellness along the way. And then at the end of that, if you are in need, you and your child can qualify for health care at no cost to the parents because you are part of that particular program. What happens is once the child is delivered after they're born, they can come into that particular program and bring the baby to school into a learning environment, not necessarily a daycare environment. This is a learning environment where your child can be with a teacher that's certified with the ratio of 1 teacher to 4 children. And all you have to do is bring your child into this loving environment where you do not have to bring any diapers. You do not have to bring any formula. You bring the baby in whatever clothing you bring them and an extra set of changing clothing. So again, if you know of any young lady, especially high school students that may have a need, or a mother, that a person that is pregnant, please think about the YWCA and tap into that resource in our community. You can check with Shai Joseph Franklin, myself, or just contact the YWCA and we'll connect you with those individuals that are needed.
That is amazing. I love it.
All right. Thank you all so much, everyone, for joining us. Are there any other questions from our audience? Any other questions? We have placed the link for Labor and Love. We have placed that link in the chat. So please feel free to email, and it's showing here on our screen, to contact and follow them on social media at labor_and_love. So please make sure that you follow up with them should you have any questions. Thank you, Shanika, for joining us this evening. It's been extremely informative. As a nurse myself, we all get into our specialties, and I know we all say we stay in our lane, and OB is not my lane. So I've definitely learned a lot, and it's been extremely informative. So we thank you for joining us again. We've shared this Wellness Wednesday on all of our platforms. So please go out and share it on your pages as well. I always feel like that the more we share things and put information in there, only if people even just see the Labor and Love and they click on it and they follow it, that's the way we get patient education out there, and we spread the word about what's going on in our community, because it's up to us to take care of us. So again, Shanika, we thank you for all the work that you're doing in that space to protect our women, to protect our children, and make sure that we're keeping families together, because if mama ain't home, nobody's home. So we truly appreciate all the good work that you're doing in this space, and we're happy to support you and promote everything that you're doing. So thank you, and we look forward to having you again once we present on this topic again. So thank you so much. We hope that everyone will have a very good evening, and please, please, please share this session from our pages to your social media pages as well. So thank you all. President Franklin, would you like to close us out, or do you have any?
I want to say, just to echo what you said, this has been very informative, and in a month where we're definitely highlighting Black maternal health. Continue to be the advocate for yourselves, as we need to be, because there's no one that can talk about our own bodies or our own selves as we can. And if there's an opportunity for you to bring someone else in to be able to speak on your behalf, know that there are other individuals out there, such as in this particular venue, that you can tap into to be able to be there to advocate for you. I'll take it back to our draft representative and make sure that she doesn't have anything final to say. Ms. Kiana Crawford-Patan?
She had to leave. That's what she did her presentation first. She had to leave. So
with that being said, we're going to say thank you. Look for continued programs to come from Baton Rouge Sigma Alumni Chapter, and we thank you for joining us this evening. Thank you, ladies, for putting this